Due to this trending video about this lady, Ochanya, I was led in my spirit to teach a little about this condition called VVF, which is known as Vaginal Fistula. Vaginal Fistula is an abnormal opening between the bladder and the vagina, which allow continuous involuntary leakage of urine from the bladder to the vagina. The bladder and the vagina, they are adjacent, they are close to each other, and the passage is different. The bladder, which stores urine, while the vagina is the canal leading from the cervix to the external genitalium. This fistula forms direct communication between two organs. What it means by direct communication is that it forms something like a whole direct connection between each other. For this vaginal fistula, even if as much as the person wants to hose her urine, the person cannot, because of that communication, the urine will continue to leak out from the bladder to the vagina. And this can cause serious infection. Causes vaginal fistula. Before, in the hospital, they always advise ladies or women to reach childbearing age because of, one, the obstetric cause, prolonged obstructed labor. If there is prolonged obstructed labor, it will lead to pressure necrosis of the bladder and the vagina. That will lead to direct communication of them. If the pelvic organ are not matured, and there is this prolonged obstructed labor. Another obstetric cause is instrumental delivery injury. Another one is neglected labor or delay in cesarean section. Another cause is trauma causes, which is that sexual assault or insult of foreign bodies to the vagina, pelvic fracture or road traffic accident, infective or neoplastic cause, which is the cancer of the cervix, bladder, and the vagina. Also, in severe infection can also cause this condition. The main symptoms when this person comes is that you find out that there will be continuous leakage of urine through the vagina. Even when the person is trying to hold this urine, the individual can't be able to do that. Other cause symptoms is that you find that the person will have urinary incontinence, constant wetness of the underwears, offensive vaginal odor, vaginal irritation or an exploration, amenorrhea, prolonged distress, social isolation, and stigmatization. This condition, when discovered on time, can have good prognosis. Maybe when the individual discovered this, I'm having vaginal fistula with the symptoms I mentioned, the person will have good results. Because when the person gets to the hospital, a lot of physical examination will be done. They will do conservative management of the person, which proper nutrition, infection control, catheter for the patient. Another method is early detection. They will do surgical repair to close up that fistula, that direct communication, so that drainage of each of the organ will have a direct channel to pass out, so that there will not be, this one cannot be passing to the other one. When discovered on time, try to go to hospital. Don't say because of the low self-esteem, depression, people will talk about. When you discover this thing, try to get to the nearest hospital that know what they are doing for early management, so that the complication that it will lead to is that it will lead to recurrent fistula formation, urinary tract infection, vaginal stenosis, infertility. It can lead to social problem like incontinence and stigma. When you discover this condition early, the person should access care immediately, so that they will solve this problem once and for all. Because when the area that have the fistula, that have the direct connection, is healed, the person can able to function well. So that's why what happened to this girl, Ochanya, can never be neglected, because the low self-esteem and the stigma that comes with it kill faster than any other thing, because you may feel that the world have rejected her, and there must be justice for this girl. There must be justice for her, because if people keep on doing the sexual assault to young people. Their organs are not strong enough, which can lead to this condition faster. These people that make these young ones to suffer this at early age must be penalized. So there must be justice for Ochanya.